Hi, my name is Dr. Anne Marie Martin, and on behalf of my colleagues at Indiana University School of Medicine, I'm pleased to present our work on associations among race, ethnicity, and the clinical profiles of young children evaluated for autism in the primary care setting. Autism occurs across all demographic groups, and despite some promising recent improvements in national trends, historically children from minoritized groups have been diagnosed later or less frequently, and Black and Latine children often have co-occurring intellectual disability or significant developmental delays in addition to autism. Finally, there may be some differences in the clinical presentation of Black, Latine, and non-Latine white, such as differences in communication or adaptive impairments, but it's important to note that this is likely due to detection and measurement bias in commonly used screening and assessment tools. In our previous research, we found that Black and Latine children who were seen at an early autism evaluation or EAE hub were more likely than non-Latine white children to receive a diagnosis of autism. Thus, to explore this finding further, we took a sample of children and examined racial and ethnic differences in their clinical profiles, including autism symptom severity, developmental and adaptive functioning, and caregiver-reported behavior problems. The EAE Hub system is a statewide tiered system of care that begins with developmental screening at every well child visit. Children between 14 and 48 months who are deemed to be at risk based on the results of this developmental screening are referred for an autism evaluation. The autism evaluation includes a standard clinical evaluation protocol of a diagnostic interview, the administration of the STAT, a physical exam, and diagnostic feedback and recommendations. For our study, 7 participating EAE hubs referred children to a larger study of diagnostic accuracy. These children participated in a blinded research evaluation that included a caregiver interview, the Mullen Scale of Early Learning, the Vineland Adaptive Behavior Scales, the Autism Diagnostic Interview Schedule, 2nd edition, and the Child Behavior Checklist. Our sample included a total of 147 children, 21 of which were Black, 23 were Latine, and 103 were non-Latine white. The majority of children were male and met criteria for autism at the research evaluation. In our examination of child characteristics and diagnostic factors, there were significant associations between race and ethnicity and autism diagnosis, such that a higher proportion of Latine children received an autism diagnosis as compared to non-Latine white children. In line with gender expectations of autism, a greater proportion of males were also diagnosed with autism. Now, there were significant main effects of diagnosis on autism symptoms across all measures of interest, such that children with an autism diagnosis evidence greater autism symptom severity, more developmental impairment, and lower adaptive scores. Now, with regards to race and ethnicity, there was a significant main effect of race and ethnicity on the ADOS-CSS, with significant differences in autism symptom severity between Latine and non-Latine white children. There was also a significant main effect of race and ethnicity on the Mullen, such that Latine children evidenced lower developmental functioning as compared to non-Latine white. And finally, there was a significant main effect of race and ethnicity on the Vineland, with Latine children again evidencing lower adaptive scores as compared to non-Latine white and Black children. There were no significant differences on race and ethnicity across the CBCL scales. Despite decreases and disparities in autism diagnostic rates, there is still a persistent overrepresentation of intellectual disability in minoritized children who received an autism diagnosis. This is evidenced by our sample of Black and Latine children demonstrating greater autism symptom severity and developmental and adaptive impairments. This really highlights the importance of future research investigating where in the referral to diagnosis pipeline are we losing less impaired Black and Latine children, and implementing targeted community outreach programs to ameliorate these disparities. It really takes a village to create and implement this work. So a big thank you to our EAE hubs, our fantastic clinical and research team, and our funders that help make this work possible. Thank you.